Turning back to the spread of coronavirus, the global death toll has now topped 4,000 and the number of confirmed cases reached over 115,000 globally. This continued uptick sparks a total lockdown, at least in Italy, and emergency measures worldwide. With us now to discuss that is Mark Harvey, the resident fellow at Harvard's Institute of Politics. You should know that he worked on President Obama's response to the Ebola crisis, and you have experience preparing government agencies for emergencies. So are we prepared in the United States?
We are prepared, and I think what we see right now is the action starting to move into a new phase from containing and characterizing the actual virus itself to now combating it and looking at mitigating the spread of community transmission.
And so what does that plan look like? Because we're definitely seeing, obviously piecemeal response, I think we can say. At your home university there's been a suspension of classes. That's happened at a number of different universities, but not all universities, right? There have been some school closures on more of a municipal level, but not everywhere. So how do we approach this?
Well, we're getting to the point where risk communication is absolutely vital. The virus is not spreading in communities across the United States at this point. It really is isolated to a few pockets. We see the most significant outbreak just outside of Seattle in King County, actually focused right around one particular in-home care facility there, or a nursing facility. And that allows us to start to characterize exactly where this virus is. We know that more testing is happening across the country right now. And as that testing ramps up, we're likely to see a spike in cases. And that's going to allow the very specific protective measures to be updated on how people should keep themselves safe and try to keep their families safe. What we see is that guidance has now been put out, and that's very broad. But particular communities and their public health systems can start attacking where we do find the virus individually. For organizations, they need to start thinking through what their actual plans are to mitigate the potential disruption by looking at social distancing and how they continue their critical functions while continuing to move people apart to help to spread some of that potential transmission that might be unknown.
But we're not exactly getting a consistent message from our political leaders, right? I mean, you can break it down by political parties in terms of there's some that are saying, it's just a flu, don't worry about it. And others that are taking it much more seriously and perhaps to an extreme on the caution side. My question to you is, does that kind of prevent some of these preventative measures from really being deployed effectively and potentially create more risk?
I don't think it's prevented those from being deployed. If you look at what's actually happened, the Department of Health and Human Services declared a public health emergency on January 31st this year. That gives the Secretary Azar a number of authorities to start pushing particular support to impacted areas. And that's what's been happening. It also has now allowed them to start focusing on creating vaccines and other treatments for the actual virus itself, and to pre-position supplies where necessary for the medical community. That's been a good focus, and that's been happening across the country at this point. As it goes forward, it's very important to start characterizing how the risk of this is likely to evolve. And I think we've started to see that shift in the last couple of days by recognizing that, yes, there will be more cases in the United States, that, yes, this does pose a risk to the public, but trying to characterize that risk and say this is not a highly fatal disease. It has impacted different populations a little bit differently by age, and if there are certain underlying health concerns for people that are likely to get it and develop more severe symptoms, but that there are also a number of people that are contracting this and recovering relatively quickly. One of the other challenges as this starts to spread and we give people that individual guidance is that this is one of the worst flu seasons in the last 20 years. And there are particular areas of the country that are seeing a number of cases for flu present, but because the symptoms are so similar, it can very easily incite a little more public anxiety on the potential spread of coronavirus. And that's where the increased testing in the coming weeks is going to be able to help characterize between flu and coronavirus, but also give people that good guidance in the social distancing on how we will stop spreading the flu this season as opposed to just the virus.
All right, Mark Harvey is a resident fellow at Harvard's Institute of Politics. Good to have you here.
Thank you very much for having me.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.